and for the life of me, I can't remember what PTCA stands for. Hey everyone, on this episode of Coding with Kate, we are going to be talking about ICD-10 PCS, Procedural Coding System. Specifically, the approaches, and even more specifically, open versus percutaneous. And I'm only covering this because I received a comment saying they weren't really sure about the differences or when to use them with certain procedures. And I too have that issue, especially with procedures that happen at the skin or the subcutaneous tissue and fascia. But today we're going to work through it. So I'm going to give examples, the definitions, and some resources that you can use. And we're going to talk about that right now. Okay, so I have my textbook that has the definitions for open and percutaneous. So open specifically says, cutting through the skin or mucous membrane and any other body layers necessary to expose the site of the procedure. So with open, they're doing a large incision and they're able to see with their eyes the body part or procedure site that they are going to be working on. They do not need any visual assistance to help them with that. Percutaneous says, entry by puncture or minor incision of instrumentation through the skin or mucous membrane and any other body layers necessary to reach the site of the procedure. Now with percutaneous, it's a small incision or a puncture, and the main thing is they cannot see with their eyes the body part or procedure site they're going to be working on. They have to go by touch or by feel to find where they're going to be working on. Also, when they're inserting the instruments, needles, etc., going by pressure and gauging the depth of where the procedure site will be, they will also use sometimes visual assistance like CT or ultrasound to help guide them to the procedure site. So percutaneous, they cannot see what they're working on. They're almost going blind unless they have that visual assistance to help them. Now, as far as examples for these approaches, for open, the big ones, the most obvious ones are open heart surgery. They are doing a large incision on the chest, using a saw to cut through the sternum down of the rib cage, and they open the rib cage up like a butterfly, and they can actually see the heart and where they're going to be working on. Another one is spinal fusions. They do a very long incision along the spine, use retractors to open the skin, and they can see the entire spinal column. It's kind of gross. There are some other procedures that are on a smaller scale, usually when they are taking out tumors, large cysts, or foreign objects, where they need to use small retractors to open the skin so they can pull out whatever object it is they need to remove, or whatever smaller body part or area they're going to be working on. That brings me to some other things you can look for in your op reports that will help you confirm that it is open, which is looking for words or phrases that indicate an open approach. Large incision, blunt dissection, use of retractors. Those are the three big ones that if they use those terms, it's more often than not open. As far as percutaneous, some examples for percutaneous is needle core biopsies, needle aspiration, some procedures that are removing blockages from the arteries like a PTCA. Again, they can't see where they're going. They are making a puncture and putting a catheter of sorts into the vein going up to the artery where the blockage is, and then they are removing the blockage through that tube. And some phrases or terms that you will see in op reports that indicate a percutaneous approach would be use of a needle, use of an IV, use of a PICC line, puncture. You might hear small incision. Those are the main ones that you will see in your op report that indicate a percutaneous approach. And then some resources that you can use to help define or figure out if this is open or percutaneous is going online, searching for the exact procedure name that you found in your op report, and adding on video. So, needle biopsy procedure video. That will give you all of the videos that show the real life procedure with real humans. You can also add animation if you are a little squirmish and you don't like some of the gross stuff, and animation is going to be the easier way to see the procedure in its entirety. And with watching those videos, you will actually get to see how they enter the body to do the procedure. And it will be very easy for you to figure out, is it open or percutaneous? Because you're actually seeing them doing it, and you're seeing the tools they are using and the techniques of how they enter the body to get to the procedure site. I highly recommend doing that whenever you have a procedure you're not familiar with, you've never heard of, or they're doing a technique that you're not quite sure what it is, or the tools that they're using. Watch the videos. It will help for all other aspects of PCS coding, and it is very, very helpful. If you can't find a video of the procedure or an animation of the procedure, go onto the coding forums and ask. That's all you have to do. You don't have to feel silly or embarrassed that you aren't sure what the difference between open and percutaneous is, or you're not quite sure in this instance. It's okay. There are tons of people that do that, and that's fine. Because these forums are all about learning and sharing information and knowledge and resources to help you code to the highest degree of specificity and accuracy. So I'll have links in the descriptions to some of the example procedures that I use, some videos that actually have the procedures in its entirety, so then you can see the differences between open and percutaneous. If I find any more, I'll add them in there. I'm going to be looking more for percutaneous ones, some variety, and hopefully this was all very helpful. I know this was a pretty quick video, but a lot of the work and searching and the learning is going to happen online actually watching the videos. So I suggest you do that. And you can always come back to this video if you need to have a review on the definitions or some of those key terms and phrases to help define open and percutaneous. But other than that, you can subscribe to this channel if you want more videos on medical coding, specifically with ICD-10-CM, ICD-10-PCS, CPT, and anatomy and physiology and how that relates to medical coding. You'll get updates on all the videos that I have, so you're always in the know. You can comment below if you have any other examples of open approach procedures or percutaneous approach procedures, or if you have any other resources that you found very helpful, please share them below. And you can also like this video if you enjoyed the topic of open versus percutaneous. And I'll see y'all later. Bye!